Did you know that the fluid around your baby inside the uterus is actually formed by baby's own urine? Yes, you heard it right. What to do if the fluid around your baby has decreased? Do we need to panic or do we have certain solutions to it? Hi, welcome to IU by Dr. Sumiti, and today we are going to discuss what is amniotic fluid that surrounds your baby inside the uterus. Well, amniotic fluid is a liquid that surrounds your baby inside the uterus. So it has many roles. First of all, let us understand how it is formed. So around 16 weeks of pregnancy, it is actually formed by the mother's own plasma, and after that the role is taken up by the baby's kidney. So the urine that baby passes actually makes a fluid around the baby, and that is called as the amniotic fluid. Now, as the gestation or as the pregnancy advances, the amount changes. So, around 28 weeks of pregnancy, the amount is around 800 to 1000 ml, that is 1 liter, and around term it becomes around 800 ml. As the pregnancy goes post-dated, the amount kind of decreases to 400 ml. That is also one of the reasons why we do not allow the pregnancy to go post-term. Now, how to measure amniotic fluid? So, we measure it with the help of the ultrasound. We either measure the single deepest pocket, that is one area inside the mama's tummy, that is the uterus, where there is no body parts, and we measure the deepest vertical pocket. That should be around 2 to 8 centimeters. Any value which is less than 2 centimeters is considered as oligohydramnios, that is low liquor. The second method is the amniotic fluid index, where we divide the uterus actually into 4 quadrants, and we measure the fluid in each quadrant, the deepest vertical pockets, and we kind of add them up. So that level should be around 5 to 25 centimeter. According to some guidelines for practical purpose, they also keep it around 8 to 18 centimeters. And then we further divide. If it is from 5 to 8 centimeter, that is, if it is less, then that is considered as borderline low liquor. If the value is less than 5 centimeters, then we call it oligohydramnios. So is it something to worry? And if it is, what to do? So first of all, let us understand the importance of amniotic fluid. So this fluid is like a pool where your baby is kind of floating. So it protects the baby or cushions the baby from external trauma or injury. Second, it contains many nutrients, that is protein, carbohydrate and antibodies, which is important for the baby's digestive system, lung maturity and even increasing the immunity of the baby. Next, this fluid also prevents cord compression because it's like a good medium where the cord and the baby can float. Therefore, it prevents hypoxia or low oxygen supply to the baby. It also gives lubrication, that is, the fingers, the toes have kind of fluid in between them, so they don't grow like this, they grow like this, which is actually important for the baby. So now you understand the importance of amniotic fluid around the baby, and that it should be within range. So what are the reasons if the amniotic fluid is less? That is, if there is oligohydramnios, and what can we do about them? So, well, there can be multiple reasons for low liquor. Number one, the most common being preterm premature rupture of membrane. That means the membrane which is containing the fluid kind of rupture, and there is constant trickling of the fluid from the vagina, and sometimes the patient, the pregnant woman, might not know that there is constant trickling. That's what we tell patients: be careful if you feel there is kind of leaking or wetness in the vagina off and on. Second, there can be certain chromosomal anomaly or congenital anomaly in the baby. So, as I've told you, that this is formed by the baby's own urine. So, if the baby's urine is not being formed, which could be because that the kidneys are not formed correctly, could be renal agenesis, that there is, kidneys are not formed, or it could be polycystic kidneys where they're not functioning properly, or if there is obstruction in the urine formation, if there are urethral valves, then this can actually prevent formation of urine and decrease liquor. Then third, there could be maternal reasons. That means if the pregnant woman has diabetes, hypertension, or it's taking non-steroidal anti-inflammatory drugs, and that side effect can actually decrease liquor also. Then fourth can be placental causes. That means if there's premature separation of the placenta from the uterine wall, even that can result in low liquor. Next reason is, as we discussed, post-dated, like the pregnancy has advanced after term, then again the liquor decreases. And the last reason could be idiopathic, that actually there is no reason, which is actually found in 50% of the pregnancy in the late trimester, that is after 28 weeks. So now if an ultrasound report says that it is low liquor or low AFI, what to do? Number one, do not panic, and your doctor will advise you take enough amount of fluids, that is to keep good hydration. You can take coconut water, you can take water rich fruits or food, that is watermelon, cucumber, so that will help retain more water. So remember, it should be around 3 liters. Second, diet is very important. Try to take more of protein rich food. Third, we even advise adequate rest, because somehow it kind of increases the fluid. And also try to lie down on your left side, because that increases the blood supply to the baby also. Having said that, if the fluid is less, then your doctor can also start IV fluids or amnio infusion, where we put inject saline inside the sac if the water is really less. And important is the surveillance that we do in terms of the ultrasound and Dopplers to keep a check on the fluid regularly. In any scenario, if you find that it is not right to continue the pregnancy and the low liquor can actually be harmful for the baby, so in that case, your doctor might even ask you for a preterm delivery, vaginal delivery, or sometimes even the cesarean section has to be done for the safety of both baby and the mother. So, in case your scan shows low liquor, do not panic and reach out to your doctor to take informed and confident decisions. And we are always there to guide you. Take care.